I think what we've learned is that it has to involve the people who are the best at it. Whether they work in a commercial setting, people die needlessly in 2014 for things that we know how to prevent and we know how to take care of. Emergencies hit all of us, they put us all at risk, but certain among us are much more vulnerable. And those are the people who are typically poor, who live in substandard housing, in low-lying areas, and we know that. At a macroeconomic reason, of course, you need to have people be productive. You need to have people be healthy and educated so they can become consumers and customers. But ultimately, we need to look at them at a micro level too. And I think the reason that many of you probably get joy working in your jobs, trying to leverage the tools and the talents within companies, is because you know that although there may not be the strongest business case, that it is probably the best thing you're going to do in your career. You're going to help people who aren't necessarily the biggest customer, but they're going to be the most appreciative person that you can ever meet.
It's a great honor to represent my company and the over 200,000 employees that work for our company in the small markets, in the big markets, in the everyday situations that are happening in our pharmacy. So it's a great honor to be here. Another great honor and a source of pride for me was on February 5th when our company made the decision to no longer sell cigarettes in our pharmacies as of October 1st of this year. I'll tell you that it's one of the greatest moments of my life as a corporate social responsibility professional. This is truly for what I would define, and hopefully you too, as the essence of corporate social responsibility, of identifying those things that really is at the peril of the communities in which you work and live. So the decision really revolved around our purpose. Again, helping people on their path to better health. 8 simple words that all of our 200,000 employees really know and understand. Every decision we make, every idea we have circles around and uses that filter as a help to everyone, whether it's a pharmacist in our stores, whether it's a mail order pharmacist, whether it's our CEO. We think about that purpose.
And so we really began thinking about the partnership, not really in terms of a grant, but in terms of how do you bring 2 complex organizations together and really address fundamental issues, both internally, but also then how could we address some really important challenges in communities where we both operated. Cargill and CARE have a really interesting, if you look at the map and where the 2 organizations are located, we really find ourselves in some of the same places and some very, very challenging places. And so we wanted to look at issues like rural economic development, food security, improving access to education, particularly for girls in places like India. How do we improve access to good food for kids? And so we began looking at these, and these are not easy issues. And so we formed a partnership that would really work globally.
But the logistics challenges that arise, you can know what should be done, but knowing how to do it is a totally different ballgame. FedEx grasped it intuitively, and I think the people, thankfully, companies are still run by human beings, not robots yet. And so I think the people who made the decision said, let's do this. And they took it all the way up to the senior leadership. They embraced it, and they've gone forward since. What's now the largest charitable medicines program in the United States would not have happened if people at FedEx hadn't said, let's do this.
For our company, coming out of the California energy crisis in the mid-2000s, we understood that our customers, and we serve 1 in 20 Americans, but virtually all of those 15 million customers are within Northern and Central California. And at that time, solar technology was relatively new at the residential level, but we knew that our customers were very interested in having more control over their energy choices, and that was incumbent on us as their only choice in terms of electric service provision, that we had to deliver that for them. And so we were looking for a way to demonstrate to them that solar at the residential level is accessible, it's affordable, you can integrate it into your home without disrupting the aesthetics, it's not difficult. And our partners at Habitat were really presenting a unique opportunity. And what we brought, which was unique, sort of above and beyond the financial contribution, was expertise to try to show and train those folks on how the program can be done in a way that didn't disrupt their volunteer operations, didn't disrupt their schedules for these builds that they do.